Hello everyone, I'm Dr. Prateek Kataria, consultant pediatrician and neonatologist at Momstory by Sahyadri Hospital. Today I'm going to discuss in brief about constipation in children. What exactly is constipation? Constipation is when your child is passing less than 3 stools in a week, or if the child is passing the stool with a lot of difficulty, that is, the child is experiencing pain or discomfort. There are certain things that can be done by the parents at home to take care of this constipation. First and foremost are the dietary modifications. In dietary modifications, you need to increase the fiber content of the food. That can be done by increasing the consumption of fruits like apples, pears and prunes. Also vegetables like green leafy vegetables, carrots and peas. Second, increase the fluid intake of your child. So increase and improve the hydration status of your child. Consumption of more fluids will help to relieve the constipation. And third, and most importantly, avoid constipating foods. Constipating foods like excessive dairy intake, besan, maida and consumption of junk food are a major problem. Now, the next point that we come to are the behavioral modifications. So in behavioral modifications, try to be empathetic towards your child. Constipation is a major cause of embarrassment and anxiety in the child. So you need to be empathetic towards your child. You need to be supportive of your child. Third thing is, we should ensure that there are regular toilet habits that are established for children. For this, make sure that the child sits on the toilet at the same time daily. Second, place a stool below your child's feet so that the feet are placed flat on the stool and the level of the knees are above the hips slightly. This position ensures good bowel movements. Next is physical activity. The more the physical activity in the child, the better the bowel movements. So make sure that your child goes down to play in the park or indulges in some sporting activities on a daily basis. The last point that we come up to are the medications. There are mild stool softeners and laxatives like polyethylene glycol that can be used in children to relieve constipation on a short-term basis. These need to be used by the parents judiciously. Also, these need to be used in the right dosage after consultation with your pediatrician. When should you seek the help of your pediatrician? When your child has constipation which has lasted for more than 2 weeks, you should go and meet your pediatrician and do a thorough evaluation. Second, if you notice any sort of mucus or blood in the stool in your child, you need to see your pediatrician. Third, if your child experiences pain in the abdomen or has multiple episodes of vomiting, you need to see your pediatrician. Bear in mind that chronic constipation can lead to urinary tract infections and hence it needs to be taken seriously. For any further queries, you can contact the number below or take an appointment with your pediatrician at Momstory by Sahyadri Hospital.